Hello, I'm Jo McDonald, the Eastern Homelessness Network Coordinator, and I'm joined by Susie Lucas from the Statewide Children's Resource Program. Together, we are presenting the Eastern Navigation Resource in relation to homelessness. This resource was developed by the Eastern Regional Coordinators to assist workers across the inner and outer Eastern Melbourne to navigate the various health and community support sectors for the benefit of people that they work with. So it aims to bridge the gap and assist service providers to understand key entry points to the various service sectors. The resource is divided into sector-specific sections and contains information to assist staff to know the eligibility criteria, the catchments, and suitable entry points. So as I said before, Susie and I will be talking to the homelessness section of the resource.
We would like to start by acknowledging the traditional custodians of the lands on which we work, the Wurundjeri Woiwurrung people of the Kulin Nation, and all the elders past and present from lands on which we work and the lands on which you may be on today. We respect all the ancestors and any First Nations people that are joining us today and recognise their continuing connection to the land and waters of this beautiful place. We acknowledge that this land was never ceded and the vast overrepresentation of Aboriginal people amongst those experiencing homelessness is a direct and ongoing consequence of colonisation. So I'm Susie Lucas. I'm the Statewide Children's Resource Program Coordinator for the Inner and Outer Eastern Metro. And my role is really resource capacity building for practitioners. It's a DFFH position and has been in the region for many years. And the way that I can support practitioners within homelessness and family violence services, but also sectors that intersect with homelessness and family violence, where people are supporting families and children, is to provide secondary consultations with practitioners. I can provide free resources for families, for children, and for practitioners, training for services and agencies. I can provide funding by way of my brokerage program, and there are eligibility criteria for that.
And hi, I'm Jo, and I'm the Eastern Homelessness Network Coordinator. So as the coordinator, I help implement the plans and projects of the Eastern Homelessness Network and also that of the Eastern Homelessness Service System Alliance, which you'll hear more about in a minute, which is the ESSA. So that's an alliance of homelessness funded agencies in the inner and outer east. The Eastern Homelessness Network is a resource to the homelessness sector operating in the inner and outer east. This is the map of our regions you can see there. Funded by the Australian and Victorian government, specialist homelessness services provide assistance to some of the most marginalised people in our communities. The services work with a diverse range of people, which includes single, adults, families, young people, women and children, victim survivors, Aboriginal or Torres Strait Islander people. Service workers are often required to assist individuals and families experiencing crisis and presenting with a range of complex issues. Some people may be experiencing homelessness, such as sleeping on a friend's couch, sleeping rough, or have just exited corrections or a hospital. And others may be at risk of homelessness and need some assistance actually, maintaining or keeping their tenancy. Some of these services provide homelessness crisis response, while others provide the support services. So the Eastern Homeless Service Systems Alliance includes all of these services. They're funded to provide homelessness or family violence services and support. And the ESSA is committed to achieving better outcomes for people experiencing homelessness and or family violence. So a bit about homelessness. The Council to Homeless Persons, CHP, says that homelessness is not rooflessness. A home means security, stability, privacy, safety, and being able to control your space. Who is accessing homelessness and support services? Some examples would be family violence victim survivors, people exiting incarceration, people in rental stress, young people and families, people who are couch surfing or sleeping rough, or Aboriginal or Torres Strait Islander people, perpetrators of family violence, older people, LGBTIQASB plus people, and children.
We know 1 in 8 people experiencing homelessness is under the age of 10. And this figure is likely to be an undercount due to the limitations of census as a vehicle for capturing people under the age of 10, but also 12 to 18 who are staying temporarily with friends and relatives, such as couch surfing. For a child, homelessness means missing out on many of the things that other kids take for granted. For example, you can't have somebody for a sleepover at your house if you don't have a home. Homelessness may also mean missing out on education opportunities, such as brand new uniforms, school excursions and camps, and it can become increasingly difficult to stay connected into education and with friendships of peers. Children don't necessarily see homelessness as whether or not they have a house, but the level of connectedness they have to their family, the presence or absence of fear and feelings of instability and insecurity. Where there's family violence or the family is without a home, children will always have their own experience. The UN Conventions on the Right of the Child, Article 12, states that children have the right to give their opinion and for adults to listen and take it seriously. So it's imperative that we do actually allow children to have a voice and to talk of their experience. Specialist homelessness services, including family and domestic violence services, are all funded to provide a response for children, and they're counted as clients in their own right. The Child Safe Standards, the MARAM framework, and the Wellbeing and Information Sharing Schemes are legislative imperatives for children to be included in service.
Thanks, Susie. So a bit about the Opening Doors framework. So the Victorian homelessness system is organised under the Opening Doors framework, or Opening Doors. In very simple terms, Opening Doors aims to provide an integrated and coordinated response by having a limited number of designated entry points into the homelessness system. If someone is homeless or at risk of becoming homeless and needs help to find housing or support, they can go to one of these entry points. The purpose of these entry points are to assess needs, prioritise and connect people to the services and resources that they need. In our region, there are 4 entry points. There's Anchor in Lilydale, Community Housing in Box Hill, Salvation Army in Nunawading, and Uniting in Ringwood. A person presenting at an entry point will receive an assessment of their housing and support needs. The homelessness services do not have a stock of housing to provide to all people who present. So there is a limited pathway for some people to access, transitional properties. A small number will access emergency accommodation, a transitional property, or maybe even a youth or family violence refuge. So however, most people will only have access to private rental, rooming houses and shared properties. Some may be eligible to some financial assistance to access these options, but in reality there's limited affordable housing available for everyone. So if your client is 16 years or over, if they are homeless or at risk of homelessness or looking for support and housing, you can direct them to call 1800 825 955 to be directed to the closest entry point or present to a homelessness entry point for an assessment. We recommend calling before presenting, especially since COVID restrictions have changed many organisations and how they operate. An initial assessment and planning worker, so an IAP worker, will assess and prioritise people according to their level of housing need and the support need vulnerability. The types of support, so at an entry point, as I said, the IAP worker will provide information on housing options and assist an individual or household to receive a crisis response and do some short-term planning with them. The type of support can include HEF, which is Housing Establishment Fund. It's a financial assistance to support people to either access or maintain private rental or to provide short-term, usually overnight accommodation for people in crisis who are homeless or at risk of homelessness. Interim support or short-term support. This is a form of very short-term support to either help divert clients away from homelessness where appropriate, or provide crisis support until more appropriate accommodation or support becomes available. There's the private rental brokerage. These are funds to assist households to sustain or establish new tenancy in the private rental market. So as the entry points are only funded to provide crisis response, not long-term support or case management, the result is usually that clients are either diverted from homelessness or prioritised for homelessness support, including and maybe some accommodation. So this is a short-term support accommodation. It's usually average of 6 weeks for people in immediate crisis. So examples can include youth refuges, women's refuges, crisis properties, hotels, motels, caravan parks. So transitional support, this is case management support to assist people to find appropriate housing and address any issues that have contributed to their experience of homelessness. The services are generally provided on an outreach basis for an average of 3 months. Transitional housing, this is medium-term accommodation between 4 and 18 months, in which residents enter into a tenancy agreement subject to the provisions of the Residential Tenancy Act. And the other option is long-term housing options, which is social housing, public or community housing, and is managed by both Homes Victoria and community housing providers. For the support elements, so it's some examples of support programs in the inner and outer east. They could be programs such as brokerage to assist people to maintain or establish tenancies. It could be family support programs, LGBTIQASB+ specific programs. We have rough sleeper assertive outreach, people who programs that will go out and talk to people who are rough sleeping, see if they can offer assistance. Youth-specific support, including refuges, support and accommodation programs for people such as those experiencing mental ill health, those experiencing family violence, and those living in transitional housing.
Support for children. Probably the best way to find supports for children, if you're not sure, is to contact me or the person in the region that you might be referring a client to do secondary consultation, as I said, with practitioners. Can provide resources and funding information. There are group work options such as Cool Kids, and there are others found in the Anglicare Parent Zone newsletter that's released in the East each term, and that has a wealth of information about supports not just for children, but for families, for singles, for young people. That's a great resource. There are programs such as Pathways to Resilience in the Outer East and Track Forward in the Inner East to provide support for children and young people and their carers who've experienced family violence. Uniting has an adolescent family violence program that is for young people and their family members where family violence is occurring in the home from an adolescent. And the Homeless Children's Brokerage program that can support children experiencing or at risk of homelessness and or family violence. And there are eligibility criteria for that. But I also have a range of other funding options that I can let you know about as well. Thanks, Jo.
Thanks, Susie. We're just going to talk about the potential challenges to access, just so that we can sort of prepare, you can help prepare your clients as well and set those expectations. Unfortunately, each homelessness entry point can work a bit differently. So some offer a drop-in service where people wait to be seen by an intake worker on a first come, first served basis, or there are others that require you to make an appointment. We always say that it's best to ring the entry points before arrival wherever possible. The entry points can provide a crisis response, not long-term case management, and there may or may not be an option to refer to longer-term support. That's one of the limitations. There's not enough affordable housing for people, and long-term housing is limited, so people can wait many years for social housing to become available. So homelessness services don't have just like a stock of housing to provide everyone. Funding is insufficient and there is limited pathways for only some people to access transitional housing. So thank you for watching. If you have any questions, you're welcome to contact either Susie or myself by email. You can also visit the ehn.org.au, which is a website hosted by the EHN and is a resource for homelessness workers. We hope that this has been a useful introduction to the homelessness sector in the inner and outer east, and along with the navigation resource, you now have the pathways to access these services. So thank you, goodbye.
Thank you.